Back with Dr. Nazari, let's talk about teeth whitening, bleaching as it is also called. There's lots of stuff out there. You can pick up $20, $30 trays at the Walmart pharmacy or whatever, and you can go and spend hundreds of dollars with a Zoom machine. There's all kinds of ways on how to bleach or whiten your teeth. Tell us how a patient should go about it, what is prudent for him to do in this whole process.
Well, as a professional healthcare, we don't want patients to go ahead and do any dentistry on their own, which end up hurting or harming their teeth or their gum. What you see on the shelves of the pharmacies or grocery stores, these are all chemicals that they need to be supervised. Without proper supervision, patients can hurt themselves. It's just a matter of safety. Even the companies, they claim that this is not as strong as dental office recommended and is safe. We still want anything to be supervised by their healthcare. Even if they want to go get it from the shelf themselves, we suggest the patients to consult their dentist, which usually the dentists don't charge anything for consultation. So they need to consult their dentist of the proper usage if there is any kind of allergic reaction or any kind of sensitivity to the material, so they would know how to deal with it. And what you see in the grocery stores and the pharmacies, they are the very, very lighter version or the not as strong version as what we dispense in our dental offices. And then the molds are not custom made. In dental offices, the dentist or the hygienist, they fabricate a mold for that patient, which is tailored to their mouth, to their teeth. But when you go to the pharmacies, one size fits all, which again is not proper. There is leakage of the material that can harm the tongue, the gum, and then the patient can swallow those. If they have ulcer, peptic ulcer, that can affect it, can harm the patient. Then they are not as effective. In the dental offices, you go in within an hour, you can come out with white teeth. But those that you purchase in the pharmacy, probably you have to use them over and over and over again in order to get the same effect. It takes longer, and probably over time it is much more expensive when you see that how many of those kits you have to buy in order to whiten your teeth.
Okay. So I can definitely see that. Basically, you might be playing with lots of it. You might hurt your tongue with the chemicals which come over. It's inconvenient. You spent weeks, months trying 2-3 things out, and things might not work. So you might as well kind of go get it done and get it fixed. What methods are there available in a dental office? What different methods are there available, and which one are you on an average using?
Well, as you mentioned, we have Zoom in our office, and then we also have the laser one. These are all different devices. They activate the material that widen the teeth, which we call it bleach, or higher.
Tell us about the difference between the Zoom. Tell us the difference between the Zoom and the laser. In terms of time, in terms of convenience to the patients, whatever it might be.
Laser can be a little bit faster than the Zoom in order to activate the material. They both work fine. The Zoom is a brand of the type of the light. It's a blue light that activates the bleaching material. It's just a brand that is very famous these days. There are other brands that they do the same as Zoom, and it doesn't have to be Zoom.
Okay.
Do that. And then also there is what is called take-home for the patients who cannot afford the in-office bleaching. What we can do, we fabricate them their own tray, and then we give them the material, and then they can bleach it in their mouth over like 7 to 10 days. They can use them 2 or 3 times a day. depending on how much they can tolerate having the trays in their mouth. Probably 30 minutes in the morning, 30 minutes in the afternoon in order to whiten their teeth.
Mm. And will their teeth be then as white or get the desired whiteness the same than with a zoom or with a laser, or maybe not quite the same?
The final results are usually all the same.
Got it. And so in terms of the zoom, how long does the treatment with the zoom last versus how long does the treatment with the laser last?
As far as it's a very good question. The teeth are all different. If you have you need to be examined by your own dentist. There are some teeth that they do not respond properly to any whitening procedure, which you need to result into what we call it veneers. These are like thin layers of enamel-looking material that we can cement or glue on the teeth. Some of the teeth that they don't respond to whitening. We need to do that. In yellow, especially yellow teeth that is due to smoking, coffee, red wine, Coca-Cola drinking, those teeth respond the best to get rid of all those, we call it extrinsic stains, get out of the teeth. And then they last depending on how the patient would take care of their teeth. Just like when you go and you wash your car, depending on on the weather situation and then how you drive and when you park your teeth. You can whiten your teeth, and if you continue your habits as far as drinking sodas, drinking red wine, and smoking, so those teeth, the whitening on those teeth do not last as the other patients that they don't have any of those other habits.
Okay, I see. So, but in terms of like time of the treatment, so I know some teeth respond not so well than other ones, but on an average, is the laser treatment faster or than the zoom, or not really? It's just a different method, and it really doesn't make a difference for the patient?
Not really. It's just a different method, as I mentioned earlier. It's just a different method of how to activate the material. Okay.
And you
have a stove, you can use a gas in order to boil your water, or you can have electric stove, gas stove or something. They both boil the water almost on the same length.
But obviously the zoom and the laser are done in the office. It's kind of a one-day visit, a one visit, couple 2-3 hours, whatever it may take, a couple hours, and you're done. Versus the tray, no matter what, you have to work for a few weeks on a daily basis a little bit.
Yes.
Okay. But in the end, if the tooth is able to be cleaned and responds to it, which you said, drinking wine, Coca-Cola, coffee, and smoking, is, actually it's a good thing that even though there's probably bad habits if done in excess, but at least the teeth whitening does respond to it, and if you keep doing it, you'll just have to go again after whatever, a year or two or whatever it might be.
Yeah, you need to maintain this. They don't last forever.
Right.
You need to maintain what we call touch-ups. You need to come back for touch-ups.
Right. Dr. Nazari, thank you very much.
Thank you, sir.